Of course, we all know navigating through the healthcare system can be a daunting task, to say the least. And here to help us out a little bit and make sure we get the best care possible is Dr. Carrie Prasant, who has authored a book called Surviving American Medicine. Thanks for joining us this morning. Off the top, I just want to know, how do you know when you have a good doctor or a bad one?
Well, there's a little mini test in our book that we have that can actually tell a person, is this doctor a good doctor for you? Now, in the past, you might say, I've had a great doctor. But your doctor may be changing. Healthcare reform is changing everything around us. Your doctor may become more distracted, may be burnt out, may be more attentive to what the insurance company wants rather than what you need. And so there's a little test in there to see if the doctor is continuing to be the best doctor for you. And if not, there's advice on where can you find another doctor.
Yeah. What are some of the top complaints that patients have about their doctors?
Well, the most important complaint now is my doctor doesn't pay attention to me. Oh. I don't have enough time. I'm in, I'm out. And so how do you get more time and attention from the physician? This is important, and we have tips in all the chapters, 30 chapters in the book, to tell you how you can get better health care. And to get more attention, tips that all the listeners can listen to.
Give us one of those tips.
So the first tip is, come in with a written list of all your questions and make certain you read them and make certain you write down the answers. Bring a family member or a friend with you, because more people in the room gets more attention by
my dad does that for my mom. My mom's a multiple-time cancer survivor, and he has notebook after notebook, and he sits there and writes everything down, and then they review. You really have to, because you get a little nervous around the doctor.
And then you forget what you're supposed to ask. And
absolutely. If you have it written down, you cover everything. And you can write down your symptoms, your signs, what you've heard about that is good for a disease or a condition.
Do you think one of the good things is doctors, I like doctors that allow you to email back and forth with them. I think that's a big access point.
Well, now there's HIPAA-compliant private messaging, better than email. But I do encourage patients to use email, faxing, to get more information from their physician, make certain all their questions are answered. Questions about their illnesses, questions about prevention, because we have so many different ways of preventing all the serious illnesses. You should be asking your doctor, well, what could I possibly be getting? What am I at risk of? And how are we going to prevent it or pick it up early, make certain I stay healthy for the longest possible time?
Very nice. Dr. Carrie Prasant, the book is Surviving American Medicine, available on Amazon and everywhere else. Very, very popular, as you might imagine, in the current state of our healthcare system. If you want to check that out, there's also his website at the very bottom of the screen there. Doctor, thanks for being here this morning.
Appreciate it.